In terms of updates in T-cell lymphomas, if we think first of all histologically, and I'm going to focus primarily on the nodal T-cell lymphomas, we know that T-cell lymphoma is a heterogeneous diagnosis, and that we have, from the nodal perspective, ALCLs, the TFH lymphomas, of which angioimmunoblastic T-cell lymphoma is the most common, and then PTCL, NOS, and that's the category where if patients have a T-cell lymphoma that doesn't fall into any other category, falls into that one. And whilst a lot of trials and treatments have been given to all PTCL lymphomas in the same way, so we give the same treatments, I think increasingly we're recognizing that with many of our newer therapies that perhaps they work better in a specific subtype than another. And I think that's reflected with some of the trials and the trial landscape that is evolving in the T-cell lymphoma field, where we're not looking at necessarily drugs in all peripheral T-cell lymphomas, but in specific subtypes. So, for example, there has been in relapsed refractory T-cell lymphoma good phase 2 data with duvelisib, which is a PI3 kinase inhibitor. And that is currently being studied in a phase 3 study, randomizing patients with TFH lymphomas in specific between duvelisib and standard of care investigators' choice of either gemcitabine or bendamustine. So, for example, on the ALCL front, we know that brentuximab works very well for this class of drugs and has been used for many years now in the frontline setting. But certainly in the UK and Europe, outside ALCL, we don't have standard use of brentuximab BV-CHIP for those types of lymphomas. I think there is still a huge unmet need for patients with relapsed refractory T-cell lymphoma. I think we know that those patients with that diagnosis don't do as well as those who've got a B-cell lymphoma. So there's still a lot of work to be done, but I think our knowledge of the underlying pathology is helping inform and giving us better potential treatment options in the future. In terms of potential interesting future drugs for peripheral T-cell lymphoma, I think we're all excited, hopefully, to see that maybe there will be increasing number of cellular therapies, which have been, very prominent in terms of relapsed and refractory B-cell lymphoma, but there's always been a concern about targets for T-cell lymphomas with CAR T therapy. But I hope in the future that there are various mechanisms to overcome that, and it'll be interesting to see trials coming up. There have been some preliminary studies, such as CAR T studies targeting TRBC1, which it's still very, very early days, but show some promise. I think where we're seeing a more active trial landscape that's more developed, if you like, is with the use of targeted inhibitors, whether that be ALK inhibitors in ALCL or inhibitors such as PI3 kinase inhibitors in TFH lymphoma, or EZH2 inhibitors in TFH lymphomas as well. So I think it'll be interesting to see how those develop, whether they can be used initially as a single agent, if they do prove to be efficacious, but then also how can they be combined with our standards of care later on